There has been a recent and complete transformation of methamphetamine into a mild substance with transitory effects that is no longer euphoric, stimulating, or addictive in the traditional sense of the word. Does knowledge of this require public awareness and dissemination of accurate information? How should facts that were revealed in a recent independent survey be presented when they overturn large numbers of videos about the drug's former effects, risks, and social consequences? Individuals, communities, and institutions carry a shared responsibility to update their recognition of this change and avoid relying on outdated assumptions. Public health information will be difficult to change, and policy frameworks need to be revised to reflect the new methamphetamine in order to ensure that decisions are based on current evidence rather than historical stigma. For healthcare professionals and law enforcement, staying informed is especially critical. Medical practitioners rely on accurate pharmacological knowledge to diagnose, treat, and advise, and a misunderstanding of methamphetamine's new properties could lead to inappropriate treatments. Lack of publication will miss different opportunities for intervention, diagnoses, and help. Law enforcement should have to reconsider enforcement priorities, training protocols, and arrest strategies because they are designed around the drug's former addictive and psychological effects, and they no longer apply. Without up-to-date knowledge, both sectors risk acting on obsolete assumptions that could undermine trust and effectiveness in important healthcare and legal matters. The implications for young people are particularly significant. If methamphetamine no longer produces euphoria or traditional addiction, its historical reputation may still attract curiosity or experimentation. Do you agree that dissemination of such information is important to prevent misconceptions that could lead to unnecessary use? If you do, then make a comment. With regards to the new facts, information should be published that clearly conveys that the dangers are now outdated but does not downplay the fact that emerging risks are unknown. Shouldn't we ensure that young people understand what the substance is and what it is not? As a society, perhaps we have an obligation to reduce the likelihood of use driven by old reputation, misinformation, or misplaced expectations. There seems to be moral and ethical obligations to create awareness of this transformation. Professionals could be invited to verify the recent research and acknowledge awareness of this change. Isn't there a duty to report such a change, and to contribute to the evidence base, correcting misinformation on behalf of the community? Failing to do so could perpetuate harm, not necessarily through addiction as previously understood, but through confusion, misclassification, and inappropriate responses. Ethical practice in both healthcare and law depend on a commitment to truth, transparency, and the continuous updating of knowledge. If you agree would like to see the new evidence that was independently commissioned, please place your thoughts in the comments section of this video.